So now that we've gone through the CLOTS acronym, which stands for chest pain, lightheadedness, out of breath, leg tenderness, and leg swelling, you can see that these are the most common signs and symptoms of blood clots that happen in the deep veins of the legs, called deep vein thrombosis, or pulmonary embolism, which is a blood clot in the lungs. We wanted to help people remember these signs and symptoms so they could seek medical attention and get early diagnosis and treatment. We wanted people to be able to recognize these symptoms for themselves, and also for their family members or friends who are experiencing symptoms as well. What we have seen in clinical practice is that people often have signs and symptoms, and they're not sure what to do. So that was one of the reasons that we developed this program, is to help with that.
Yes, and I mean, often in our clinic, we will, I'll hear that, oh, you know what, I wasn't aware that I was short of breath, or I didn't really notice my leg is swollen, but it was my wife, my husband, or somebody else, a friend who pointed out, hey, you have this, maybe you should get it checked out. So again, being aware of these signs and symptoms, it's important to help ourselves, but also our loved ones, because, these conditions could be life-changing, even if not life-threatening. So we want people to be aware, to be knowledgeable, so they can help themselves and others. So we hope this is useful. We think CLOTS is easy to remember, and it really does highlight some of the most important signs and symptoms that patients can have when they have a deep vein thrombosis or pulmonary embolism.